Hi, good afternoon. This is Dr. Alekya Reddy, obstetrics, gynecology, and a fertility specialist. And today we're going to talk and discuss the topic ovarian cyst. Though it's a very common topic and we are coming across quite often, we have a lot of doubts and people are really scared as soon as they hear the word cyst. So I wanted to simplify and help you with the norms. Yeah? Okay, what are ovaries? Ovaries are the part of female reproductive system which are located on lower abdomen on both sides of the uterus. Women have two ovaries. Its basic function is to produce eggs and as well as a few certain hormones. In the ovary, sometimes a fluid-filled sac called a cyst may be developed in either side of the ovaries. The cysts are usually painless and asymptomatic, but in a very few cases where we'll discuss further, that you can feel the symptoms and we have to treat it. All right. What could be the causes? Major question which we come across is what is the cause of the cyst and why are we seeing now? Earlier we never came across. So one major thing, infertility especially, or in any gynec problem, you need to understand that you won't get through the scans very often. But when you are taking a treatment for fertility or any gynecological problem, then you often have the scans. So because you are doing the scans, we come across a cyst. Earlier, if you had the cyst, because most of the time it's asymptomatic and it has no signs most of the time, you don't get to know that if you had a cyst previously or not. All right. The major causes, one could be when the follicle is unable to release the egg during ovulation and instead continues to fill in the fluid within the follicle. Then the cyst can get formed. In sometimes the follicle gets released, but still some amount of fluid or blood is retained and it is entrapped in a fluid in a sac, I would say. Then that is most commonly called as corpus luteal cyst. Then, what are the risk factors of the ovarian cyst? The potential risk factors could be history of previous ovarian cysts or any irregular cycles, in some hormonal imbalance, uh, usually in obesity, if your BMI is more than 28 or 30, in that. If you had early menstruation, like if your menarche was before 11 years, we've seen that you have uh, often come across ovarian cysts. Yeah, while I'm still speaking, ovarian cysts lead to ovarian cancer? No, it's a very rare norm. Yeah. And in hyperthyroidism, the cyst can form. In the tablets like tamoxifen therapy used for breast cancer, there we come across a lot of cyst formation. Okay. What are the types of the cyst? There are majorly we can classify into functional and complex cyst. In functional cyst, I would say there are two types, which is a follicular cyst and a corpus luteum. Follicular cyst, as we told you, as I just mentioned earlier, that if the egg is released, if egg is not released from the follicle, and a lot of fluid is enclosed or entrapped in the sac, then it is known as a follicular cyst, which is mostly painless and it will go eventually. The second type of simple cyst could be corpus luteum cyst, where the egg is released, yet a certain amount of fluid or blood is retained in the sac and it is retained in the ovary. So that could be a corpus luteum cyst. And then when it comes to complex cysts, there are certain kind of complexes. One we could say as PCOD. What is PCOD? It is a polycystic ovarian disease. In this, multiple follicles are present. Normally, on either side with a normal AMH, normal reproductive age group, I would expect 7 to 8 follicles on each side. But in PCOD, you see more than 12 to 15 follicles, which are which are spread over the edges. Usually, they have a big stroma, and over the edges, the cysts are formed. That is known as PCOD. We will discuss about it in detail. Next complexes could be cyst adenoma. It is a non-cancerous growth that develops from the outer lining of the ovaries. Then it could be a dermoid cyst. Dermoid cyst is a solid cyst which usually contains tissue, skin, sometimes even a teeth instead of the fluid, and it is not associated with fertility. Usually, dermoid cyst has its own pattern. We need to remove it, but then it's usually not associated with the fertility. Excess bleeding symptom of cyst? No, very rarely. You might have irregular bleeding. I'm just answering the questions in between us. You might have irregular bleeding, but excessive bleeding is a very rare symptom. And then endometriosis cyst, which is a major cause of infertility, if at all we are talking about the cyst. So in this, what happens? Uterine lining tissue grows outside the uterus and attaches at the ovary surface. So that is also known as endometriosis, endometrioma, or endometriosis, which can be seen in the pregnancy. But and they're usually functional cysts, and it gets resolved. It gets resolved eventually in the second, third trimester, or right before the childbirth. It gets resolved. Okay. The signs and symptoms of the cyst. It could be pain during intercourse or pain during menstruation. Uh, could be abdominal fullness. You might feel bloated, or you might always feel full. That could be one of the symptoms. You might feel nausea or vomiting. You might have weight gain. Uh, you might have disturbance in the menstruation. You might have irregular periods, especially in PCOD because of the hormonal imbalance. The periods are usually not regular. There could be unusual bleeding. There could be spotting or intermenstrual bleeding. That in between two menstrual cycles, you might feel bleeding. There could be that. And sometimes you might, if the cyst is larger in size, it could affect the bladder, and then it could have bother you in the micturition, inability to empty the bladder. There could be breast pain. There could be pain in the pelvic region, lower back, lower thighs. That could be one of the symptoms. So, then when do we really have to reach out to the hospital? What are the immediate medical attempts which we have to take place in case of if you have severe pain in abdomen, or sometimes there is severe pain in abdomen which occurs all of a sudden. That could be the sign of rupture, so you need to be very very careful in that. Sometimes you feel so weak and dizzy, sometimes you might just faint. There could be rapid breathing, there could be abdominal pain, vomiting, and fever altogether. So, in such cases, you really have to reach out to the doctor, and because you will need the medical treatment immediately. So, you can't delay. Can cyst grow dangerous? We have the other tissue like high blood pressure. Not really. It has nothing to do with the blood pressure. You don't have to worry. Yeah. And now, how do we test? How do we diagnose about this cyst? First major thing would be in case of PCOD, the pattern, like the irregular cycles or the hormones are elevated. The LH hormone is usually elevated. That is one of the pattern. Usually, the scans, the ultrasound pelvic transvaginal scan is the most common tool to find out if you have a cyst, and especially the scan to be done between day 2 to day 5, because that's when the new follicles are recruited. So then we know if it's a cyst or if there is PCOD or there's anything, because eventually when you come up to the mid cycle, then you might have the ovulation taking place. So you can't differentiate between if it was just an ovulation or a cyst. So the best time to do is between day 2 to day 5. Okay, so someone had asked me 1 month ago, she fainted due to lower abdominal pain and then diagnosed with cyst, but still gained a little bit of weight and had irregular periods. So, first of all, you need to consult the nearest doctor. For the pain, they'll give you certain medication, and for the irregular cycles, they'll do the scan. In the scan, if the cyst is still persisting, they give you certain medication, hormonal medication to reduce it. If it doesn't, and we have to wait and watch how it gets resolved. Usually by medication it should get resolved. If it doesn't, then we can think of a surgery. Yeah. Coming back to how do we test it? So one is the scan, which is the most common tool. Sometimes the laparoscopic surgeries, it could be an incidental finding that there is a cyst inside. And sometimes if it's not coming down, the cyst is not reducing with hormones, we need to check it if it's benign or any other tumor. Then we need to take the biopsy, which is again done with laparoscopy. So laparoscopic ovarian biopsy, laparoscopy really allows doing that. The other thing we check is CA125, that is a cancer antigen. So that is usually used to rule out the ovarian cancer. If we see a cyst, then we need to rule out if it's a tumor or if it can lead to cancer. Then CA125 is very helpful. But you need to remember CA125 is again raised in endometriosis and fibroids also. So you need to keep that in mind. The other method where you can check about the cyst is hormonal test. Usually in PCOD you have irregularity in the hormones, as I told you before. The LH hormone could be high, whereas in a normal follicular cyst it can be normal. So hormones also will determine the type of the cyst, and it will help you treat it. Okay. Now, treatment. When we come to the treatment part, as many of you get frightened by just knowing that there is a cyst, you don't have to worry about it. Keep calm. You don't have to rush into things. It is something very commonly seen, and as I told you, because we are doing the scans often now, so you'll get to know about it. But there is nothing to panic about it. But you need to visit the doctor just to rule out every possibility, and then we can come to a conclusion. So, okay, basically, functional cyst does not require medication. Usually, it resolves on its own. But in case it is persisting, then we need to keep certain medication. And because of the major problem here would be pain in abdomen. So for that, you can definitely use the painkillers. And for the no, functional cyst, we can give you OC pills, that is the hormonal birth control pills, because that regularizes your hormones and thus the cyst also gets resolved. Um, can you tell us general difference between different causes and symptoms? No, it is almost the same. One is a disease and one is a syndrome where you see the symptoms. Most of the symptoms are the same. There is no particular difference in some of them, so you don't have to worry. Then what else can we do for the treatment? In case of a ruptured ovarian cyst, so in case of dermoid, in a ruptured ovarian cyst, because it can be internal bleeding and all of that, then you might need a surgery. In case of dermoid, so it's type of a benign tumor, it also requires a surgery. It won't resolve on its own. And then depending on the cyst size, again, we can decide the treatment. If it's more than 4 mm, then we usually take up for a surgery and we do follow up rest of the things. And the first line of management in the surgery would also be laparoscopic so that it's less invasive and the recovery is faster and the complications are lesser. So usually we try to remove it uh, laparoscopically. And again, if it's the childbearing age group, we need to be further careful. We need to rule out every possibility because she has to conceive again. So very carefully, the surgery has to be done. The other most common question would be PCOD and endometriosis because among the cysts, only these two are the main. So in endometriosis, people say the studies and the research say that the chances of getting pregnant is only 5 to 6%, whereas as compared to a healthy woman, where the chances of getting conceived of the cycle is 15 to 20%. So in endometriosis, we sometimes give GnRH agonist that blocks the ovarian stimulation hormones and lowers the E2 levels, which increases the chances of conception. In endometriotic cyst, again, we can use certain hormones to balance it, and later on, If the size is more than 4 mm, then usually surgery is an option. But even before going to surgery, you need to check everything else. The ovarian reserve and everything else has to be checked, and then only proceed towards the surgery. Can I have ovarian cyst issue post having a baby also? In that case, how will it affect my body if I want to conceive again? Yeah, this is very common. So even after first baby, you might face this issue of ovarian cyst. So in case, as I told you, it's just a functional cyst or a normal cyst, you don't have to worry. It will resolve on its own. But in case it's persisting and it is not coming down, then it's better you use pregnancy further. And PCOD also many of times they don't realize earlier. Once you have a baby, then you have irregular cycles and all of those. Then we check it on the scan and we get to know that PCOD. And major problem with PCOD is you won't ovulate on your own. The major problem with PCOD because you have irregular cycles, you don't know when you are ovulating, and most of the time you don't ovulate on your own because of high LH hormone. So in that case, you'll need ovulation induction drugs to conceive. Yes. So you need to be very watchful. Yes. But then it is very common to get a cyst, but you don't have to worry about it. Yeah, we are open for the questions, and if you have any other further doubts also, you can ask me. Regarding as you keep asking that we didn't have any symptom. As I told you, most of the cysts can be painless, but usually in endometriosis and all, you have heavy dysmenorrhea, that is a lot of pain during menstruation. So that has to be kept in mind, and you need to visit your doctor if you have it often. And if it's particularly PCOD, then the major symptom would be irregularities. If you have irregular cycles and all, then again you need to come. Abortion cannot lead to the cyst. It is a myth. No, abortion cannot lead to a cyst. Yeah, but anovulation can lead to a cyst where the ovulation is not taking place or the egg is not getting released, and that can cause a cyst. And again, a cyst formation cannot lead to abortion. Vice versa. It's very rare. It's not intelligent. Yeah, I think most of the questions will be answered because it's a very small topic. But I want to get this up because many of you have the doubts that the cyst is a major cause of infertility. Yeah, we can. All right. Yeah. So some people have asked that when do we come to the conclusion of IUI or IVF with the cyst? Okay, so if it's a simple cyst, then not much to worry. Maybe if it gets resolved, then you will ovulate on your own, and then you ovulate on your own, then you can conceive. In case of PCOD, again, the first line of treatment after regularizing the cycles with hormones and after using the adjuvant medication, after using the supplements, you can again come to ovulation induction with either letrozole or clomiphene citrate. And if it's that's not working, then you can use a few gonadotropins for the ovulation to take place. And if it still doesn't happen and your tubes are fine, you're ovulating on your own, and if it still doesn't happen, then we can consider IUI because then you have PCOD, ovulatory PCOD, and yet not conceiving. Then you can think of IUI, where it is known as intrauterine insemination, where we prepare the sample and we introduce the inseminate the semen inside the uterus during the time of ovulation. And if not, if you still don't supplement, we can do a 3 to 4 cycles of IUI, and if everything is fine and still not conceiving, then we might have to go to IVF. And again, someone asked us that when do we go for IVF in cyst? So only the cyst won't be the cyst affect our eggs even during IVF process. Not really, but then the IVF process is lengthy, and as we give a lot of medication, a lot of injection, we have certain criteria. We are very particular about starting the IVF cycle. If there is a cyst in the beginning, especially more than 12 we usually do not start the IVF cycle. So the cyst usually cannot, because we assume that the cyst has to come down. Again, which kind of cyst? If it's a functional cyst and all, then we're gonna do that. If it's PCOD, and then if one of the cysts is more than 12 again we don't do it. If it's endometriosis, then that is a different agenda to different topic altogether. In that, even if the cyst persists and its endometriosis is where we know the injections won't affect it, then we can go ahead with the IVF cycle. And the IVF cycle, the first criteria would be a scan on a day two, where we see if most of the follicles are of the same range or the same size. So in that, if you have a few cysts, then we would not start a IVF cycle. I don't think that's the best cycle to start, because you'll have a hormonal imbalance, and again, when you're giving injections, the cyst might increase in size, and then there are chances of rupture. So we're not gonna start the IVF cycle if you have a functional cyst on a D2 to 3. After getting diagnosed with the cyst, how often should we get checkup done? Um, Depending on what are we up to. If we are thinking of the if you already have children and you are not worried about the fertility, then you might check in every 3 months. If the size is persisting and if it's less than 4 mm, if it's asymptomatic, then you don't have to worry. If the size is increasing and then sometimes the size is more than 4 mm, and if you have symptoms, you have bloating, you have pain, you have other breathlessness or something like that, then it has to be dealt with. It has to be operated or whatever. And as I told you, that the most important symptom would be if you have severe pain all of a sudden, then you definitely have to rush to the hospital, because they need to do the scan and check if the cyst has ruptured or not, which is very important. Can ovarian cyst cause early menopause? No, not really. It cannot. Usually not. We have not seen it quite often. IVF in ovarian cyst. As I told you, IVF in ovarian cyst with a functional cyst or corpus luteum or something, we're gonna wait if this is really big, like a functional cyst is really big, follicular cyst is really big, then we're gonna wait that cycle, and from the next cycle, when the follicles are synchronous, we're gonna start the IVF. And in case of dermoid cyst, anyways, you get rid of it with the surgery. In case of PCOD, we again measure all the follicles. If they're even, then we can start. The process is same even if you have this. The process is the same. That second day we do the scan, we send certain hormones, we revise the hormones, we start the medication or injection from day three. The injections will go up to almost 9 to 10 days. We start doing the scans from the fourth or fifth day of the stimulation to see how the growth is going. Then once we feel that most of the follicles are of the same size already, then we give you the trigger, and depending on the AMH and all, and from person to person, after 34 to 36 hours, we do the oocyte retrieval, and then the ICSI is followed and the embryo transfer is done. Yeah. So the process is the same as you were asking, but it may vary from person to person. Again, depending on the AMH, LH, FSH, E2, P4, the hormones, and yeah. So that would be the criteria. But in the process, nothing major changes with the cyst or without the cyst. It's almost the same. Okay, I think I have answered most of the questions. If you have anything else, you can leave in the comment section, and we'll get back to you as soon as possible. It was nice talking to all of you. And yeah, if anything else is there, just leave a comment below. Yeah. Thank you.